there's really two ways to use diodes in hygiene, and it really depends on licensure and state rules or province rules. So you have to be aware. If you want to just kill bacteria, meaning use the diode with an uninitiated tip, it's not going to cut with an uninitiated tip. You just want to kill bacteria. Then you're going to go ahead and place that tip in the sulcus 10 or 15 seconds per tooth, and you will actually kill bacteria in the sulcus. And the studies show that as an adjunct to scaling and root planing, diodes do way better than scaling and root planing alone. If you live in a province that allows you to remove tissue, as a hygienist I'm talking about, then you can do true laser pocket therapy, where you raise the energy a little bit, use an initiated tip, you move it around in those inflamed sulcuses for 10 or 15 seconds. When you take it out, you're going to have tissue on that tip, internal granulation tissue on that tip. Go back into that same sulcus, continue that same procedure 3 or 4 times until no tissue comes out, and then you've eliminated that inflamed tissue in the pocket, and you move to the next one. Remember, this concept is based on the theory that diodes like pigment and hemoglobin. Well, what's granulation tissue or inflamed tissue? It's full of pigment and hemoglobin. Once you've removed that from the sulcus, then what happens is that sulcus is clear, and you can go ahead and move on to the next one. Well, I want to just show you this. Look what happens with my orange again if I use an uninitiated tip. Even if I go slow, nothing. Absolutely nothing. That's the difference between an initiated and uninitiated tip. Now, something to note is that when you go into a periodontal pocket that has granulation tissue, well, that's going to be full of pigment, and tips can what we call self-initiate. It's the equivalent of firing that tip into articulating paper. So it's important, not that your hygienist will do harm, but for the hygienist to practice in a medical legal fashion, it's extremely, extremely important that when coming out of the sulcus, that tip is wiped with gauze and water. So let's show you this with an uninitiated tip. Let's show you what I would do. So I would place the tip, let's say, into the sulcus. Let's find a place we have a periodontal pocket in the sulcus. I would then go to the bottom of that sulcus, pop the tip up a millimeter or so, fire that tip in the pocket in a sewing machine type motion. So up and down, up and down, up and down. Now you see what happened, the tip self-initiated. Even here against the calculus, that tip, look at the glow, it's self-initiated. But now what happens if I want to remove tissue? What happens if you're licensed or you're in a state where you can remove tissue? Well, now I'll raise the energy to about 0.8 of a watt, And now what I'll do is that same manner, I will kind of scoop up because I'm going after that internal wall of tissue. So I'll angle that tip as best as I can, scooping up. I'd have tissue on my tip. I'd wipe that, go back into the sulcus, take it out, wipe it, go back into the sulcus, and when I have nothing left, then I'll move on to the next tooth and go in the same fashion. When we're working with an initiated tip, the patient must be anesthetized. When I'm working with an uninitiated tip, they will not feel a thing, and they do not have to be anesthetized.